Hi everyone, this is Anna Gutierrez from Texas Children's, and today I'm going to talk to you guys a little bit about instrument care within the operating room, specifically during the procedure, what should be happening to these instruments. I recently did an education on it last week, and I wanted to describe a little bit about the roles that they have to play specifically on the care and the management of their instruments. We all know that the techs do a really good job within the operating room in handing over those instruments to the surgeon and doing that part. But I wanted to touch a little bit more on specifically what our guidelines are within our facility. And so I'm going to specifically talk in relation to what we have in place at this facility, just to give you guys an idea of how we introduced it. So we do have a guideline. It acts as a policy or procedure that we have in place within our facility, but it's a guideline. It's called Care of Surgical Instruments or Guideline. And what we describe in that process is that the scrub person is going to be the person that's going to be managing that inventory, the instruments in the back table, but also caring for them during the actual procedure. And one of the things that I described to the team was that it doesn't specifically fall on the responsibility of the scrub tech, simply the scrub person, because there might be a nurse that's playing the scrub role within that procedure or that case. And so I wanted to make sure that they were aware of that. Specifically, if there's ever a case where a surgical technician is not in the room and there is a scrub nurse in the room. The other things that we touched on was that instruments needed to be kept of gross soil. And so it's understandable if there is blood still left on the instruments, but we don't want our surgeon to receive back an instrument or a cannula that still has gross soil on it, or it's cannula that's clogged. And so we introduced that periodically during the procedure, they need to be rinsed or flushed with sterile water. And that's stated in our guideline. The other part that we talked about is wiping the instruments periodically, but we were very specific in letting them know that you should be wiping with sterile water. And so not saline, because the instruments are being introduced into an environment that already has other chemicals or chemistries on that surgical field. And so we want to make sure that we're periodically taking care of the instruments outside of the surgical field within the room, just to make sure that we're removing salts or any kind of chemistry that might damage the instruments if they prolong on the instrument. I do touch on micro and ophthalmic instruments for those areas or procedures where they're using micro and ophthalmology based instruments. We wanted to make sure that in those procedures that they're mindful of how they're using the instruments. We're not supposed to be using enzymatics. Enzymatics have been known to cause TASS, along with other things that have been known to cause it, but we want to limit the risk of having TASS associated with the way that we're handling the instruments within the operating room. And so I do cover that they should be periodically wiped down with sterile water. I do have a separate section in which I speak on, it's another slide, in which I speak on specifically eye instruments, making sure that they're not being sprayed down with enzymatic solution. I also talk about using a towel, a sterile towel that's dampened with sterile water and just laid over the instruments, simply because that's what is stated in their IFUs. And so it's something that we wanted to bring up on a yearly basis, sometimes on a quarterly basis to them, just as a reminder that you're not supposed to be using enzymatics or really any other type of product because of the risk associated with TASS. And then we remind them to be flushing and rinsing the instruments periodically with sterile water on the field, so that as the surgeon requests those instruments over and over again, that they're handing them an instrument that's useful and still in good conditions without them being clogged and having to stop the procedure. And then finally, we let them know that the scrub person is responsible for dismantling and moving on to point of use treatment at the end of the procedure. And so we let them know that they're responsible for disassembling, for dismantling the back table, putting everything back into the baskets, into the containers, into the stringers, if that's a practice that you have at your hospital, to make sure that everything is back in its appropriate place. We also talk about the point of use treatment. For example, if they're using enzymatics or if they're going to be laying down a towel soaked with sterile water. We also talk to them about what they're supposed to be doing as far as the treatment of it and the transport of the instruments. So in regards to the transport, in some of our areas, we use case carts, but in some other areas, we use a solid bottom, solid side container. And so in our guideline within our facility, we talk a little bit about that, and we provide a little bit more of a guidance to them so that they're not, I guess, thinking or assuming that they can just carry a set down the hall. Even though decon might be right around the corner, they still have to use some kind of transport device to appropriately bring those or transport those instruments into decontamination. That's pretty much all I have for you guys today. So if anyone has any questions, just let me know, and I'm here to help. Thank you.
Surgical trays, yeah, you keep everybody safe. You should get all the moolah, the smackers, the Benjamin's cabbage. So that's why I'm happy to say you deserve it. Yeah, you earned it for your hard work. Yeah, lives at stake. You keep us safe, fat and dirty, never complain. The real MVPs are certified. Yeah, it's time you got a raise. So it's your payday. It's your payday. It's your payday. It's your payday.